Good evening and welcome to Health Quest. I'm Anna Carrion and it is my pleasure to welcome all of you here tonight. So I'm sure we all agree that the COVID-19 pandemic has disrupted our world, but the recent development of effective vaccines is providing new hope to us all. In the midst of our hope and excitement, it's important to separate fact from fiction. So we are thrilled to have our guest speaker tonight, board-certified immunologist Dr. Praveen Buddiga, with us to give us the scientific facts about the effectiveness, safety, side effects, and importance of getting the COVID-19 vaccine. Dr. Buddiga brings over 16 years of clinical experience in allergies, asthma, and immunology to his private practice. He opened Family Allergy Asthma Clinic to provide patients with a supportive environment for diagnosing and relieving their symptoms. He's board certified by the American Board of Allergy and Immunology and is an assistant clinical professor at the University of California, San Francisco and UCSF Fresno. Dr. Buddiga, thank you for being here.
Thank you for having me. So I want to start out with a very important disclaimer that this is an educational scientific talk and it does not substitute for medical advice. Please contact your doctor for any medical advice, and I really thank you for your attention. So if you have any questions, please do type them in the questions box and on the side to the GoToWebinar toolbar. This is my disclosure statement. I've received no compensation from any pharmaceuticals, vaccine manufacturers, or governmental agencies. And as long we're doing the disclosure statement, I do want to thank the staff of my organization, Family Allergy Asthma Clinic. Without their support, I could not have done this talk and sustaining my practice. I also want to thank my wife and daughter for their support, as well as my parents throughout my education. And I really appreciate community medical centers for giving me this opportunity to share my knowledge here. The objectives of the talk is understanding the COVID-19 vaccines, the side effects, the effectiveness, the safety, and the importance. Especially at the time of this pandemic, it's very, very important to understand because there's a lot of misconceptions and mysteries about what COVID vaccines are and what they do. So I'm here to demystify those things and try to bring in the science where science belongs and direct us in better care for our patients. And that's why it's very important that we bring the bench research down to the bedside. And in this case, it was wonderful because we were able to do it in a matter of months rather than what normally takes almost about 20 years. And I will also share that with you. So starting off, this is the novel SARS-CoV-2 virus back in November of 2019 and December of 2019 and first reported in the scientific literature. This is also the virus that, as you can see, has spike proteins around it, and these are the specific spike proteins around it. And these are the ones that they like magnetize towards the SARS-CoV-2 or the ACE receptor and ACE2 receptor, and then enter into lung tissue or a nasal tissue or respiratory tissue. This is a picture or a cartoon of, actually this is a electron micrograph picture of the SARS-CoV-2 invading normal tissue. And I attached this important slide to understand, to basically show how important to understand that SARS is not a new thing for us. SARS-CoV-1 presented itself to us in 2002, in the winter of 2002. And we kind of delineated most of the protein structure as well as the genetics at that time. And this research back done in 2002, and the special pandemic centers, the CDC, as well as HHS, the Health and Human Services, as well as Dr. Fauci's in charge of the NIAID, which is the National Institute of Allergy and Infectious Disease. And he had a whole team working on this, and that's how they were able to decipher the genetics of the spike protein. And this helped us, when this really came about in 2019, this helped us really design and manufacture the vaccine in such a super fast way, because we had already the structure, the genetics. We just had to put, a couple of Lego toys together and then go from there to actually manufacture the vaccine. Moving on, this is an updated, as of March 2nd, 2021, and as you can see, we have like the significant impact that it has caused everybody all over the world. 115 million cases, and 2.5 million global deaths, as well as in the United States we see 28, almost touching 29 million as of today of cases. And this was a good website to follow. It was formed by the Johns Hopkins University of Medicine. Coming to the United States, it has devastated our country, because our country is number one in the world in terms of cases and deaths. Now we see like 29 million almost number of cases, as well as above 500,000 deaths. And I really want to take just 2 seconds of just to recognize how much it has devastated our country in terms of population. I have lost friends, and I have lost a lot of doctor friends who have served all over the country. And I just want to take just a second here to really thank their families, as well as wherever they are, for whatever they have done to save numerous amount of lives and sacrifice their lives. As you see the counts, they are increasing. This is actually the United States cases in March of 2nd this year, 28.7, and as you can see, the curve is actually going up, and that's what I want to really come and express to you guys, everybody, how important it is to see that this curve is still kind of on the ascent. We need to see this curve coming down, and as the vaccine is rolling out. And that's where this slide comes in and shows the 7-day moving average. And as you probably heard of the fourth wave and everything in the media, well, this was last year in March when all the schools closed, and this is March probably the 12th or the 13th, and you see the first wave, and then this is due to the summer, you see Memorial Day, it started the second wave, and of course the Christmas and Thanksgiving started the third wave. And they've been, this up and downs kind of shows the openings and closings. And this January, in this December-January interim, what happened was Pfizer got FDA approved emergency use authorization for its 2-dose vaccine. And then a week later, that would be December 18th, I believe, Moderna got its approval for its 2-dose regimen 4 weeks apart. These are mRNA platform vaccines, and both started being distributed, and basically healthcare workers as well as the other essential workers were being vaccinated. And you can see the steep decline in cases, and this steep decline in cases I directly attribute to the advent of these vaccines, successful vaccines, which showed almost about 94 to 95% effectiveness. Now we have another vaccine just entered last week, which is the Johnson & Johnson one-shot dose. So I see and I hope that this curve right here diminishes and we don't have a fourth, incline upwards due to rapid opening of different businesses and industries. And this should be slowly done in a tiered way and based on community by community. This is to continue, again, the need, the reason for this slide is basically the need. We still need the vaccines to be implemented, to be rolled out, and to be administered into the arms. And we also must continue masking because this is the only way we can protect transmission. Even though we're inoculated, we need to get at least 4 weeks after the first dose and 4 weeks after the second dose. That would be a total regimen of 8 weeks to build up almost 97 to 98% immunity against this virus. This is a log scale of the global cases. This is the global death curve of the pandemic. And again, this global, as you can see, it's going still ascending. This is the global cases. And as you can see, this is an important slide to understand the global daily cases. And as you can see, this really uptick right here is because of the November Thanksgiving, December Christmas, and this actually decline you see is because of the vaccine starting to come out. Again, the vaccine starting to being distributed into the arms. Same thing over here, very world daily death rate. Again, this declined because of the vaccine being rolled out throughout the world. This is a picture of the coronavirus, and you can see the spike proteins right here, and those are the ones that actually attach to the ACE receptor and enter the human cells. Moving on to vaccine design and development, which is how the vaccines were designed and developed. This may be a very busy slide, and I apologize for that, but I just wanted to show two important points. Here is the viral vector vaccine, which is the Johnson & Johnson that got approved last week, which uses an adenovirus, or the adenovirus that causes the common cold, and using that as a Trojan horse to introduce the specific gene of the virus so we can develop antibodies to it. The other important is the RNA vaccine, which was actually approved in December 11th and 18th, which was initially Pfizer and then Moderna over here, and BioNTech and Pfizer down here. And these were the two. So in the United States, the key is RNA vaccine and recently the viral vector vaccines. There are a couple more coming. AstraZeneca is in the process of submitting its data to the FDA. Again, this is another busy slide, but I just want to show you guys the company Johnson & Johnson, J&J, which is an adenovirus. This is a little older slide, but Pfizer and Moderna both belong to the mRNA platform, as you see here, which stands for messenger RNA. And AstraZeneca is behind, but it will be shortly available once it attains what I call FDA emergency use authorization, which is a fast track of the FDA to get the vaccine out there. So in this slide, what we see is basically mRNA 1223 and 1273 and BNT-BioNTech 162, which are the two mRNA of the Pfizer vaccine, as well as the Moderna vaccine, which are the mRNA platforms. The other platform is the FDA's right here, J&J, which is Johnson & Johnson, and Hansen, which is actually an adenovirus, like I said, and they actually use the machinery here of the cells to produce more antibodies by presenting after antigen. This is the base of immunology. You present you present a piece of the virus or a clone of the virus to the antigen presenting cell, and then the antigen presenting cells detect that it is a foreign protein and it's not your protein, and therefore it basically mounts a huge immune response, as we see here, and just trying to get rid of it. And this happens 24/7, 365 throughout our lives. This slide kind of goes over the race of the coronavirus, and I wanted to just show how the vaccine was developed, because there's a lot of, I just wanted to bring the science here because we already know from 2002, from the SARS-1, as we saw in the previous slide, that we already had the framework and the structure, the genetics of a kind of like a SARS-1 virus. So that really helped actually move really fast from 2020, mid-2020, for the academic research, the preclinicals within a few weeks, and we moved to actually phase 1 and phase 2, phase 3 trials. We started building factories. At the time of phase 3, they were building factories concurrently as well as manufacturing, because everything was going in the positive direction. They wanted to make sure that we had the vaccine ready to go as soon as we get the FDA use authorization, because of the studies were so strong and favorable statistically. As a normal vaccine, coronavirus, or any other vaccine for other issues or other diseases, it takes such a long time. Like for HIV, we still don't have a vaccine. It goes through preclinical stage, phase 1 trials, phase 2, and usually that takes, if we were to do the normal route, we would be ending with a vaccine in 20 of 36. That's like, that's like a couple of decades away. But since we had a lot of things already in place by the prior administrations, and the funding, the National Institute of Allergy and Infectious Disease was able, as well as BioNTech and Pfizer, it was a collaboration of everybody that brought, even Oxford University and Germany were able to bring a vaccine to market in such a fast time that works wonderfully. Understanding what the novel SARS-CoV-19 virus is, well, we're all susceptible as humans. The entry, we didn't know initially back in February how it was being transmitted, and then slowly we understood that it was the respiratory tract, and that's why we understood that person-to-person transmission was very fast. And then the 6-foot rule came up, at least 2 meters, social distancing, to avoid large crowds, don't touch your face. Everybody remembers this. And of course, the most critical part was wearing the mask, because I think the mask, even though it is a small barrier, it reduces the transmission as well, getting the virus by almost from 97, 98% down to 2 to 3%. So that small barrier does wonders, and has probably saved thousands and thousands of lives throughout the world. The primary symptoms, it was understood that it was all over. I mean, all systems were involved. It caused coagulopathic disease, like clots, like pulmonary embolisms, clots in the legs, and most of the deaths were due to this, and also the not clear understanding of the disease. Excuse me. The symptoms may last for about 2 to 4 days after exposure to the virus, and usually this is what we see, mostly fatigue, muscle, body aches, cough, sore throat, and other symptoms. These are the proposed routes of the SARS-CoV-2, and initially we didn't know what the transmission was, and we found out it was through the air, and it was through aerosols. And 2 of the most deadly viruses transmission modes or vectors are always dreaded by everybody. Number one is through the air, and number two is through water. And hopefully we can start preparing in case for such a water pandemic. So hopefully we can, share some research dollars in that direction. The mechanism of viral entry into the cell is by, as you can see, the spike protein. It attaches to the ACE2 receptor and enters the cell and uses its machinery to basically replicate and take over destroy our human physiology. The novel SARS-CoV-2 is testing. How do we do it? Well, testing. The gold standard is PCR testing and antibody testing. But PCR testing used to take a couple of days, and that became a big deterrent because people wanted to get answer immediately within 15 minutes. So they developed the rapid antigen test where we would get the tests and answers within 15 minutes. And that was very, very useful because you can make spontaneous decisions. You can immediately contact trace as well as isolate and quarantine and prevent further transmission and transfection of others, especially close family members. Understanding the temporal considerations for diagnosis. This is the PCR antibody and again rapid antigen spike protein. As you can see, this is the SARS virus and everything goes up, like the antibodies as well. The antibody detection takes about 2 to 3 weeks, but the PCR picks up viral particles, and actually it's the same area where the antigen is also found, and it can be found in all these areas: nasopharyngeal swabs, viral bronchial BAL, bronchoalveolar lavage, stool PCR, IgM, and IgG antibodies to the blood. This is back probably in the fall of last year. We needed good studies to show us what we could do, and it showed that these were some of the remdesivir, dexamethasone, convalescent antibodies, and these are the drugs to have been shown to have some benefit by the preliminary data to help actually arrest the replication of this virus. And this combination or this cocktail, you would think, has saved again thousands and thousands of lives. And actually, I had one staff member have this cocktail in the hospital, in closed community hospital where I'm talking from right now, and she did really well. It gave us a big scare, but she did really well. And we are lucky to have such institutions here and direct availability of these medications. Shifting gears, this is exactly this is the oxygen, this is the blood system, this is your trachea, this is the alveoli, this is the lungs actually, and you have the blood system here. And this interface is where we notice a lot of problems, as you can see, where oxygen blood gas exchange interface was not, a patient was showing an oxygen rate of 84%, 82%, was talking on the cell phone in New York City on his bed, trying to make stock deals, trying to make business deals. And people were really doctors are amazed, how can they be so, and still be, because under normal circumstances, that patient would be intubated. So we were still learning about the disease early in the spring. Moving on, and the problem was, alveolar damage in the lungs. You see this clot here, the thrombus. Many patients died of PE, so we understood it was a coagulopathic disease causing more clotting. This is the viral antibody response, and basically you see the function of IgM here, and then IgGs, which are all immunoglobulins which are formed, and which actually help complement activation and sensitization of natural killer cells. And these are a part of our innate immune system, where we have two immune systems. One is the innate immune system, and number two is the cell-mediated or adaptive immune system, where it kind of adapts and gives you the long range. It gives you the long range protection, and that's the concept of the vaccine: is to give you one dose as a primer and the second dose as a booster to give you that cell-mediated long-range protection, almost about 1 to 2 years at this point, as we're learning. Moving on, the mRNA platform vaccines against SARS-CoV-2, Pfizer, Moderna are the leaders right now, which have FDA emergency use authorization. And as you can see, the primary endpoints were met with 95% and 94.5%, with a p-value of less than 0.00, which was statistically significant for the age group, for the different age groups. So, therefore, the FDA granted on December 11th emergency use authorization for Pfizer-BioNTech in 2 doses of 0.3 ml each, intramuscular, and 3 weeks apart. There were some case reports that, of allergies or allergic to polyethylene glycol, which is also known as PEG. And any patient who has had a severe allergic reaction or anaphylaxis to this component is not recommended to get this type of vaccine. But going on, this is the data. This was the placebo, and this is actually the Pfizer vaccine. As you can see, the complete flattening here and versus placebo of the incidence of the disease after giving the first vaccine. Some safety signals right here, localized pain at the injection site with the first injection, and this is mild. They were graded with mild, moderate, severe grading, and this is basically with the Pfizer-BioNTech within 7 days of vaccination. Again, this is the Pfizer vaccine side effects. This solicited systemic effects after, antipyretics are ibuprofen, Tylenol within 7 days of use, and still we see a little, fatigue, which was a key. There were 2 main side effects. One was that I've noticed is more fatigue and headache at using these mRNA platform vaccines, which may be Pfizer or Moderna. And in pregnancy, pregnancy is important because in this case, there's only one study so far that has shown that this vaccine, or Pfizer-BioNTech, is safe to give within the 3rd trimester only. But we need more studies to really understand more about this. This is the Moderna vaccine, which a week later got FDA approved, and this is for age 18 and above. And remember, the Pfizer vaccine is 16 and above. So if you're 16 years old and above, and eventually when they qualify, they should be getting the vaccination. Again, this was 2 doses in the Moderna at 0.5 ml each, intramuscular, at least a month apart, hit or miss a few days. This is a mechanism that one should understand, and this is the mRNA platform. It's very similar to both Moderna as well as the Pfizer. But basically, you get the vaccine in point 1, you go to it presents it to the antigen presenting cell, which activates T cells, activates B cells, and the B cells basically form more antibodies and form memory cells, and killer T cells, and this whole cartoon, or actually depiction of the process, gives us that antibody protection and the safety that everybody needs to prevent us from getting COVID-19. And so this was such a miracle, almost a miracle, to have the mRNA platform vaccines of both Moderna as well as Pfizer, and and the speed at which we got it. The safety data, again, they looked at safety data. Some of the common adverse effects were headache, fatigue, typically on the same within 24 hours, but resolving in 24 hours. And this kind of goes over binding antibodies, and we can see at different doses. And as we can, same thing at different doses, the study days, compare it with convalescent plasma. The mRNA 1237, also the Moderna second dose efficacy, again, it showed nearly about, 95%, as you can see here, efficacy against the spike protein. This is some of the warnings, again, were pregnancy, because we need more studies. This is the preliminary safety data. Again, the key is, most of the people had pain, a little erythema, but the main thing that I was considering was mostly fatigue was seen with the Moderna vaccine, and within 24 hours, all these resolved. This is the latest one of last week, Johnson & Johnson getting approval. This is the Adenovirus Vaccine, and as you can see in the safety data right here, it's a single shot, which is a major advantage over the other vaccines. And also, this vaccine does not require the refrigeration demand that the Moderna and Pfizer vaccines have. Pfizer requires a negative 70 degrees Celsius storage and cold chain custody, whereas the Moderna needed about negative 20 degrees Celsius cold chain custody. So it's easy to transport Moderna as well as Johnson & Johnson compared to the ultra low temperatures required by the Pfizer vaccine. So as we see in the news today, the Johnson & Johnson vaccine is 66% effective against overall moderate to severe disease, 85% effective against severe, 100% effective against hospitalization and death, and that is a key endpoint at which we look for. And it's 57% effective against the South African variant. Again, what do we do? Mitigation, mitigation, and mitigation. Masking is universal. We should mask even after you got the vaccine. Please mask, because it takes about 8 weeks it's a course of 8 weeks. We develop immunity, but we need to mask until 80 to 85% of the United States population, if you're traveling in the United States, gets vaccinated, because that tells us that we've reached herd immunity. And also following wash your hands, do not touch your face, social distancing, these things are still valid. And opening up early without these in place is not such a great idea, and that may be a cause for the fourth wave. And also sanitizing surfaces, of course, is important on a regular basis. And these are eventually new habits that we all are going to learn post-pandemic. Very important point. Vaccinate, vaccinate, vaccinate. Please get the vaccination, because that is our only protection against this virus. As we know, going back to that, as we put vaccination pressure, the virus is very smart. It's going to notice that there's a vaccination pressure. So what is it going to do? It's going to start to mutate. And that's where this genomic epidemiology is so important of the different variants. It's going to notice that pressure coming, and it's going to start to mutate. And this is the spike protein we see here. And then, as we can see, the phylogeny are the different types across the world of the strains of how it changes genetically. This is another cartoon, kind of shows how many genomes we have in almost over a year, from December 2019 to November 2020, and we're in 2021 now. And these are the variants we should watch out for: the UK variant, the B.1.1.7, the South African, and the B.1.351, and the 501Y V2 for the spike protein. The Brazilian is also out there, but mostly in the United States, we're being affected by the UK and the South African virus as of today. The UK variant right here is circulating in the UK, and I think because of travel back and forth between the UK and the United States, it's rampant. It's becoming the major dominant variant strain in the United States. South Africa variant is also slowly entering the US, and that's why I think some of the travel bans or the travel restrictions, quarantines are still kind of very, very important. The concept of contact tracing, testing also is very important. Vaccine hesitancy. This is very important because we should not be hesitant against vaccines because this is our saving grace here, and this is the holy grail to get through this pandemic throughout the world. There's a quick idea about R number. As you can see over here, R4 basically tells how much we can transmit and spread. And as you can see, if a person is immune right here, and it is less, and people, as long as you're immune, you're less susceptible. If you don't have a vaccine, this is how the disease progresses right here. Herd immunity is what we need, 80–85% in the United States, and then this will impart long-lasting immunity in all populations. Herd immunity can only be obtained through vaccination. Any mRNA vaccine or adenovirus vaccine that is FDA emergency use authorized provides that protection against falling sick with COVID, prevents hospitalization, prevents death, and prevents significant transmission. And this is a wonderful thing because we can, if we can prevent transmission, we are basically closing in on the virus. Prevention against variants, as well as it's important to understand that there are clinical trials underway for children because right now only 16 and above are approved. 12 to 15, the trials are underway. We should know by the end of summer whether FDA grants us approval in that age group, and then we should, change our hats and get our children vaccinated after that. And as we're going through this, vaccinations are going to be modified based on the variants as we learn which is going to be the predominant variant. And Moderna and Pfizer are already working on that. But our goal as an individual is to get the vaccination, everybody, and try to reach that goal of herd immunity of 85%. This is a quick video. I'm going to, for time's sake, I'm going to just move forward. And this is the M protein, and this is the protein that helps new virus particles develop. And this is, as you can see, this is the internal part of the coronavirus, and this is how the virus invades the protein. The spike protein gets in touch with the ACE2 receptor, and at the level of the lung cell, and then basically the fusion machinery attaches in and then enters the lung cell, transmits the mRNA, the proteins and the virus. It takes about a few days to minutes, and then it takes our machinery and makes virus protein using our own replication machinery, as you can see here. And the new virus particles are formed. It enters the lung cell membrane, causes bronchiectasis, causes scarring, causes activation and reproduction of more of the virions, or virus. What does the cell do? It releases interferon as the main, deterrent. More macrophages come in, more immune cells come in to protect us, and that takes about 3 days. And at the same time, we need to understand the virus is replicating. The virus particles, the B cell, antibodies are trying to disable the virus, but they are just overwhelmed by the amount of virus or virions that come in. The B cells help. The T cells are the markers of immune system, and they try their best, but they are overrun by the virus. And as you can see, the lung cell, the sensor protein goes into the nucleus, uses our genes, causes the messenger RNA, causes the ribosome, causes interferon to come. Same thing with the virus protein. Let's skip through this. This is the drug target zone, is where we want to help a target. Again, another drug target. And there are different antibodies through that we're producing for all these different targets that are available right now. And so the antigen presenting cell presents it to the helper T cell, and which eventually presents it to the B cell, and this is all basic immunology 101. The antibodies disintegrate and disable the virus. It forms the killer T cells, which go after infected lung cells and tries to destroy it. And then, of course, the memory T cells are formed. So a year, 2 years later, when your body sees it, the memory T cells are activated and protect you. And that's how the mechanism of this coronavirus works. In summary, the COVID vaccines are safe. They're effective for ages 16 and greater. Clinical trials are underway for younger ages. All three vaccines, the Moderna, the Pfizer, as well as J&J or Johnson & Johnson, are effective to prevent hospitalization and death due to COVID. So it's very important that we get vaccinated. And the main barrier, such as masks, prevent transmission as well as getting infection. So please vaccinate, wear masks, and please hand wash or sanitize. And I want to thank you for your attention today, and I'm open to questions. And I do appreciate the County of Fresno Department of Public Health team for their support, their partnership during this difficult time for provision of a safe platform as well as an equitable distribution, which is so important with racial disparities of distribution of this vaccine, so we get whole of America, vaccinated, as well as the communication and the customer service that the County of Fresno Department of Public Health has provided us as an organization. My team at Buddiga Family Allergy Immunology really appreciates their help and their communication and customer service. You can always Instagram me, follow me at Dr. Praveen Buddiga. I also have a LinkedIn site, and if anybody wants to reach out to me or has any questions, my phone number is 559-421-9009. That's my office phone number. You're welcome to reach out, and I am an active immunologist. And I do want to do a shout out to my brand management team of Brandy Kamenar, Shannon Dowd, Steve Levine, and Ms. Foss, and others who have brought me to the stage I am today. Thank you so much.
Thank you, Dr. Buddiga. So we have a lot of good questions, so we're going to try to get through some of them. The first question, if you are vaccinated, will you test positive for COVID?
Very good question. If you get vaccinated, you will not get, you have antibodies. You will develop antibodies, so you will test positive for basically COVID protection. But this is a very tricky question because you may have been infected in that particular zone time, 72 hours before, like I showed you on the slide of how at that time your PCR will show a positive that you have actually active virus of COVID. So people who have active COVID are just recovering from COVID or had COVID 40 days ago should not receive the vaccine until they're 90 days free and clear. So from the first time they got COVID. So that's a very important, thank you for the question. And it's very important to know that, because if you do, which has happened in some of the cases I've heard about, if you do get the vaccine during active COVID, you're getting a double whammy there in terms of you're going to get, as long as you have COVID disease, now you're introducing another vector of COVID to build up antibodies. So that is you're putting yourself in a very dangerous spot. So the short answer to that is basically, please do not get vaccinated within the 90-day window period of having COVID.
So if someone has an autoimmune disease, should they get vaccinated, or would it affect their autoimmune condition?
My recommendation, this is a good question too. In my practice, I see a lot of autoimmune conditions, and I see a lot of other comorbidities like diabetes, heart disease, and the consensus statement basically by the CDC recommends that anybody with comorbidities that are a higher risk, like diabetes, obesity, heart disease, any kind of immune diseases, they should get the vaccine, but they should also talk to their doctors one-on-one regarding the safety, because there are so many autoimmune diseases out there: lupus, juvenile rheumatoid arthritis, and every autoimmune disease has its own pattern. So I would ask, the response to that, the short answer again to that question is, please contact your doctor, because this needs individual doctor care.
This is probably this needs individual doctor care question too, but if I've had a reaction to a swine flu vaccine or another vaccine in the past, an allergic reaction, are the COVID-19 vaccines safe for me?
Very good question, and this is directly with you should consult with your doctor for that one. And I'm not trying to blow the question off, because I did have a patient this afternoon, who had almost like an anaphylaxis kind of presentation with the Pfizer first dose. Within 3 minutes, she developed out-of-body feeling. She started getting hot. She started having some minor hives, so that those kind of it's a case-by-case basis. And once she said it's a clinical judgment call at that time, and she showed some signs of clear anaphylaxis, and the time frame also 2 to 3 minutes was very reassuring. So I actually told her, my medical advice to her at that point was not to receive the Pfizer second dose, and to go ahead and change her platform, eventually maybe wait for about 2 months and receive the Johnson & Johnson vaccine, which was a completely different platform than the mRNA vaccine. So my advice to her was, please do not receive the Pfizer vaccine, even as the second dose, and please do not receive the Moderna vaccine, because they belong to the same platform and the same thing may happen, and to go ahead and receive the Johnson & Johnson. So you see, the answer may be simple or very complicated, and it's a case-by-case basis that one should ask their doctors.
So this question is a little similar, but I've had the first dose of the Pfizer vaccine, but hearing that the Johnson & Johnson vaccine is effective against the South African variant, should I not get my second Pfizer dose and try to get the Johnson & Johnson?
I disagree with that. You should, whatever platform you have started with, you should complete that series, because it's been shown that if you started with the Pfizer, please get Pfizer the second dose as a booster, because it's like a lock and key, and they work in synchrony, and that's what the randomized trials that took place with last year showed, that you get the 95 to 96% effectiveness providing you get those two vaccines. Once you change platforms to a Johnson & Johnson, which is adenovirus, we don't know. There's been no randomized trials. There's been no clinical studies, and it's not something that is recommended at all. And that's a question, again, that you need to talk to your doctor about.
Okay. So if you're thinking of starting a family, which of these vaccines will not change the genetic makeup of my cell, and which one is safe for baby development?
Studies are going on right now, and I cannot recommend any type of vaccine if you're planning to get pregnant. We need to wait for the results of those studies. But the patients who are already pregnant in their third trimester, the study out of UT Dallas has shown that it's safe to get the mRNA vaccine only if they're in their third trimester. And that's a randomized study that has shown those results. So, but if you're planning to get pregnant, I would really wait until the end of these trials to understand which of these is a safe vaccine.
But do any of the vaccines change the genetic makeup of your cell?
No, none of them, because we need to understand none of these vaccines change genetic makeup. The mRNA vaccine platforms actually, basically, it's like, you have this bottle, it's like a cap. So this is the spike protein, right, of the coronavirus, and we're making antibodies to the spike protein. But here's your coronavirus. We're not giving you coronavirus. We're just taking the spike protein and making antibodies. So when your body detects the spike protein, it attacks it and brings on immunity, brings on cell-mediated immunity that gives you the long-term protection against this. So this is just almost like a Lego toy, and that we're given, and then we get the protection. So there is no genetic kind of manipulation.
So do we know how long we're protected from COVID after we get the vaccine?
That's an excellent question. Current research and studies show that we get about 1 year, but as we're moving along, as we're getting the vaccines month on month, we're seeing a huge improvement in the number of antibodies, the titers of the antibodies against COVID, and we're seeing almost about 96 to 97% protection as we move down. So I anticipate we might have so far we have 18 months of protection, and I anticipate we probably will end up in that range of 18 months to 24 months of protection before we need another booster.
So if I get the shot, is there some way that I can report any side effects to help grow the knowledge of the virus?
Yeah, everyone who gets the vaccine actually in the United States is given a pamphlet which basically gives you the website and a QR code actually where to go to report any kind of adverse events. And actually I would recommend people to sign up for that, because that also alerts them to receive their second dose, as well as it kind of gives you any updates regarding the lot numbers or any other updates that the CDC or the FDA puts out.
So we have time for one more question, and it is, why do we not have immunity if we've recovered from the virus?
Can you repeat that question, please?
Why do we not have immunity if we've recovered from the virus? So why do I still need a vaccine?
Very good question. This is the basic immunology 101, and it's very important to understand that once you have been shown, once you get coronavirus, you develop antibody protection, which is basically innate, is your antibody protection. But this antibody protection doesn't protect you indefinitely. It protects you only for a few months, and that's why there is you see in the media that people ask for donations of convalescent plasma because convalescent plasma contains those antibodies, the neutralizing antibodies, which can save lives of patients who have COVID. So it's very important that a person who had COVID disease, even if it was later last year or early this year, wait their 90 days and get their vaccination, because once they get their vaccination, they will develop the true antibody protection that they need, because their actual disease antibodies usually just fade away within 4 months of protection. So the short answer, please get vaccinated, get that antibody protection that you need for almost a year to 2 years. And if any variants come along, well, we can modify the vaccine and get a booster shot. And good luck.
So I hope you enjoyed this webinar as much as I did. And from a lot of the thank yous that I'm getting in the questions box, it sounds like you did. So thank you again, Dr. Buddiga, for sharing your time with us this evening.
Thank you.
And thanks to everybody for joining us.
Thanks for having me.
Our next webinar will be on Thursday, April 1st at 6 p.m. Dr. Amar Khan will be giving a talk, Stroke 101, How to Avoid a Catastrophe. Finally, you will receive a survey after we end the webinar. Please take a moment to share your feedback with us, especially about any topics you'd like to hear about in future lectures. Thank you and have a good night, everybody.